Well, hello, everybody. I'm John Laughlin, Director of FVD International, Forum for Democracy International. We're in the European Parliament today. I'm delighted to welcome as my guest today Marcel de Graaf, Member of the European Parliament for Forum for Democracy, Joachim Kuhs, Member of the European Parliament for Alternative für Deutschland, and Willem Engel, who is a campaigner and chairman or president of Virus Truth, Virus Wahrheit, which is a pressure group that campaigns on the issue of vaccines and COVID-related policies. We are discussing today the letter which Marcel de Graaf, Joachim Kuhs and other members of the European Parliament have written to the European Medical Agency. In this letter, which is a 20-page document or so, very densely argued, and which I encourage our viewers to read. You can find it on Marcel de Graaf's website, and also there's a link to it from fedinternational.com. There are a number of arguments made in favour of this appeal to withdraw the vaccines. Some of the arguments concern procedures, procedures which were either not followed or which were deliberately violated or changed in advance. Other arguments concern the use to which the vaccines have been put, allegedly wrongly. There are also arguments concerning the harmful nature of the vaccines, and even arguments concerning alleged confusion between the batches which were used for testing and the batches which were actually used on people. Marcel, among all these arguments, perhaps you'd like to tell our viewers what has brought you to do this letter, and what are the most important points, do you think?
Yes, well, to start with, and that's why Willem Engel is here, I got a copy of the letter that Willem sent to the Dutch medical agency with a lot of the same arguments as that we used in that letter, because I contacted Willem and I said, well, we like to use your letter as a concept and we had to rework it, of course, because we have a completely different legislation for the European Medical Agency as for the Dutch institute that approves medicines. So we had to rework it, but I got this letter and I was shocked, because we already know a lot of things about these COVID vaccines. We know that they're not effective. I mean, if a vaccine is effective, then why got 4 of them or 5 or whatever, because they still don't work after the first time, which in my time, when I was young, a vaccine would create immunity immediately.
Well, you made a video about this not so long ago. You said if they worked, you wouldn't need boosters all the time.
Yeah, so that's
pretty obvious.
Exactly. So that we knew that already, and we know that the details on the contracts are not given to the public. So it's all with secrecy and hidden SMSs and money going to places where we don't know if it's used well or not. Taxpayers' money. So we already had an idea that this whole thing was messy and in some way corrupted. But then I got this letter, and it basically said, well, this approval and the way we got to this approval is also completely messed up. And messed up in a way that really shocked me, because if you approve a batch, a certain vaccine or certain medicine, then you expect that the medicine that is approved is the medicine that is applied to patients or to citizens. And if there's a difference between that, then you are basically being vaccinated with a non-approved.
With something that wasn't approved.
Whatever substance. So, well, that really shocked me, and that was why I was so enthusiastic about the action of Willem, and that I said, well, we need to take this to a much higher level. We need to take this to the European level, because every European citizen is being exposed to something they shouldn't be exposed to.
Well, one of the points that struck me, I mean, a number of the arguments are rather technical. They concern procedure and so on, but there's one detail that I think anyone can understand, and that is that the descriptions, the official descriptions of these vaccines run to respectively 574 pages and 224 pages. And doctors are supposed to read these thousands of pages to decide whether or not to administer these vaccines. Joachim, is that for you the most important point? That struck me as an example of the European Union, because this is tolerated by the European Medical Authority. Actually creating illegality. It's actually creating a regime of illegality. It's a gigantic machine for generating legislation, as we know, the European Union. But here it is creating objectively a system of illegality, because no doctor has the time to read these 500 pages for each medicine that he prescribes. What led you to sign this letter?
I think it's many things. As Marcel said, there are so many things which are going really wrong in a very big scale. Therefore, it's so unbelievable what we find. We look on one aspect, and then you find fraud or something else, something really. So hindrances and big mountains, you cannot surmount them. Yeah, so you cannot go. You must go outside of them and beyond them. And therefore, it's so many things which are really stunning and stunned me. It began at the beginning. It was in the first year when the things went wrong, and it didn't change. And I, as a member of the parliament in the committee of budget and budgetary control, I was very much involved with money. It's a money issue, you know, and it went wrong so wrong for me as a very frugal person who thinks you must pay for all things, and now they have billions of euros throwing to the pharmaceutical firms about money, about things which are not proven, which are not safe, and which are say for themselves say we cannot say it's safe. Yeah, and that was for me. It was an enlightenment when the one of the directors of Pfizer told the committee who was looking into it that she said, we didn't know it, and therefore we have no proof that it is safe.
That's right.
That's so insane, and therefore I was very alert, and I spoke a lot about the thing and about vaccination, and at last I was a little bit annoyed about our president Metsola when she wrote letter after letter that we should be vaccinated again.
Yes.
Therefore, that was for me thinking. And we wrote to her and said it's not okay. We should not be coerced to be vaccinated.
Well, coercion is the, or at least interference is the key. I mean, I'm very interested in the procedural aspects. I was struck as well by the evidence you found. I imagine you found this, Willem, that the European Medical Authority tried to accelerate the procedure. In other words, instead of sitting there neutrally and waiting for providers to come to them and show that their product is safe. And so these procedural things fascinate me, but I suspect our viewers are more interested in the substantial medical issues. Are they safe or are they dangerous? You claim they're dangerous.
They're clearly dangerous because they did not follow, and one of the procedures that was overlooked or fast-tracked, and it's called a major objection, and it has a lot to do with the good manufacturing practice. That says that you have to have the procedure down to the minutiae, so you know that the product is always the same wherever you produce it and whenever you produce it. That was clearly not in order, and that probably has led to the differences between those batches. So some groups of batches have a very high incidence of adverse effects, but you do not know beforehand which ones. So the precautionary thing here to do is to say, we have to regard all batches as unsafe. So that's the first thing. And you cannot change it to say, well, only 4% of the batches is unsafe, so that's an acceptable risk.
And why are the different batches differently dangerous? Or
we're talking about vaccines erroneously. This is a new platform. It's an mRNA platform which technically and scientifically and also legally is considered advanced medical therapeutical